Hi everyone, this is just going to be a short video tutorial on how to use the new templates that are in place right now. To start with, I'd like you guys to go up to the File area and click on Templates. From there, you can add the ones that we're going to work on into your favorites. So you can just hit on Configure My Favorites, and then just make sure you add the first 6 templates that are there, all that start with an asterisk. You can do this by just clicking on one and hitting the button over here, and it'll add it just like that. Once that's done, hit save, and then you can close out of that window. From there, all your favorite templates should be stored on the right-hand side. For this case, we're going to go through somebody that has cold symptoms. So we're going to move over the URI template by hitting the arrow button to add the template into place into the current visit. Once that's uploaded, you can go through the different parts of the template to get your history. All of these areas in the HPI are clickable. So you can start by just clicking on the different areas such as respiratory symptoms and go through these in this order. You can tell what's happening with any nasal congestion, sore throat, ear pain, fever, cough, and add those in. You'll see that that does trigger additional questions in terms of the ear, as in which ear it is. It could be both. And then fever, you can add the most recent fever that was recorded for the patient. This allows you to add how many days they've been having the symptoms for, and if they have any additional chronic diseases we need to be aware of. Again, some of these may add additional links into, or additional questions, such as if they're using their inhalers, if they have asthma, and if their blood sugars have been controlled or not. If you want to add additional information, you can put that into the notes and say what has been going on for them. Once you're through with this, you can just click close, and all that information is going to populate into your HPI. This more or less covers the main symptoms that you're having. If you feel like you want to add anything additional, you can click on the upper header, and this will take you into what you're probably familiar with in terms of documenting prior to this. And you can add anything you would like into the notes. For example, daughter also has been diagnosed with strep. In that particular case as well, we do have a score that we can use called the center score. In this category, you can again come back out into the area with your HPI and click on the center score, and it allows you to go through the different questionnaires to determine what the appropriateness is for doing any testing for strep throat. So in this situation, you can use her scoring based on her age, if she has some swelling to the tonsils or any lymphadenopathy. We said her fever is already up. She does have a cough. And then we can add up our total score to equal 3. Using that information, we can go into the MedCalc with the website that's listed there, just by pulling up in your Google store. And you can add in the features that you found with this patient to decide whether or not you should be doing testing. And in this situation, you would consider rapid testing. This is just a tool that you can use, and by no means you have to follow all those guidelines. As you then go through this, you'll see that the review systems is per HPI. You can go ahead into that area and make any adjustments if you'd like to. We then do have the vitals, which should be in there from your MA, as well as an exam that is populated to be completely normal. This allows you to go in and make any adjustments that you feel necessary and decide if you want to add anything more. You can then go from there into the assessment category, in which there are multiple different assessments that could be possible for these conditions. From here, you really can just click and remove any diagnosis you don't feel is reasonable, and that'll leave you with the one that you choose as your final diagnosis. From there, you can again get into the treatment protocol and use what we are using now for an order set. This will help you document your plan a little bit quicker. For that, go up into the order set icon here, which is the red stop sign. That'll take you into a variety of different order sets. For our case, we would like to use, again, the star with the URI, so the same titling as what you're using for your template. This will bring up a list of medications that are most likely in your clinic, and you can order them straight off of here if you'd like. Click on the area on the left side and then hit order. This will place that into your medication order set. You can then scroll through the rest of the areas and decide what else you'd like to add. If there's any testing that you feel is necessary, again, you can click on those areas and hit order as needed. This also does allow you the ability to add in anything you have for follow-up, as well as for any notes you'd like to add. Each area here gives an example of what you can do for the plan, including a viral illness, sinusitis, sore throat, strep throat, otitis media, and influenza. If you'd like to add any of these pre-populated notes, you can go ahead and just click on that and add apply. And then once that's all done the way that you would like it, you can click out of this box. It'll take you back to the plan and give you the information that you've already placed. In here, you can of course come back in and adjust any of the medication or any of the information that you'd want. And up here, you can go ahead and click on each of these to adjust the medication if necessary, and then go ahead and prescribe. You can then work yourself through the rest of the visit as you would normally do, onto the billing area, where then you can document what your billing codes may be at this point, depending on what you've done for the patient. If you already clicked the follow-up in the order set, you won't need to do that. Otherwise, you can add in here what you feel is appropriate. From there, you can be done or close out your encounter, and you'll see that your note has already been completed. Most of this can be done during the patient visit as you're talking with them, because it is clicks of a button, and it should be easy documentation from there.